Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you today the 96th edition of the COVID-19 Community Briefing. Today is March 15, 21. I'm going to start out with our local scoreboard today. Again, not that it's that critical, but it's kind of important to keep the total picture in mind as well. We do have 1,877 positives of 9,956 tests. That's through our health system alone, so nearly 10,000 tests. The last 2 weeks, which is a little more significant, would be we've had 31 positives out of the 270 tests over the last 2 weeks. And that represents an 11.4% positivity rate. Sioux County, the 14-day average is 4.5% at this point. And that compares to 2 weeks ago at 4.8 and 3 weeks ago at 3.9. So 4.5 is a slight decrease over where we were 2 weeks ago. The 7-day positivity average is 5.3%. 2 weeks ago it was 6.7, and the week before that was 3.9. In terms of individuals testing positive in Sioux County, we now had 4,839. Over the last 2 week stretch, that is an additional 70 positive individuals. And if you take that over, that's about 35 a week, and that's been pretty consistent over the last several weeks in that mid 30 number of positives. Stepping up a level to Region 3, the 20 counties in Northwest Iowa, we have 29 hospitalized in those 20 counties. 5 of those patients are in the ICU, and of those patients, 2 are on ventilators. Now, stepping back to the entire state, if we look at the 14-day average in Iowa, it is a very good 3.9%. That's down from 2 weeks ago at 4.2, which is down from 3 weeks ago at 4.3. The 7-day moving average is 3.8%, down from 4.5, which 2 weeks ago, and 3 weeks ago was 4.2. So very strong numbers in the state of Iowa, both under 4%. In terms of the number of Iowans hospitalized somewhere, that number is 160. That is down from 2 weeks ago at 196 and down from 3 weeks ago at 222. So good numbers again relative to Iowans hospitalized with COVID somewhere. In terms of Sioux County residents, we have 1 Sioux County resident hospitalized. And more for curiosity than anything, Polk County remains number 1. That's the county where Des Moines is at 31, and they're number 1 in the state. One of the statistics that means we're not over this yet, we're not completely through the tunnel, is the number of deaths. And the number of deaths in Iowa is 5,641. That is up 170 over the last 2 week period of time. Sioux County remains at 69. That has not changed now for a couple of weeks. In terms of the demographics of the deaths, 94% remain at 60 and above in terms of age, and again, 0% under 30. So 0 under 30, 94 over 60 plus. That's been pretty consistent for a long time now. That's it for the stats. I'm going to talk a little bit about kind of the status of things going on here at the health system. And I'm going to start with senior care and break that down a little bit between Landsmere and Prairie Ridge. At Landsmere, we're basically open. We're limiting guests, I believe, to 4 per apartment. And we're not entertaining guests for meals at this time. But otherwise, things are fairly normal at Landsmere Ridge. In terms of Prairie Ridge, starting to open up a little bit more as we're permitted to do. Room visits are now being allowed by family members. We're just asking for responsible behavior there, masking on the way to the room, that kind of thing. And please call out there if you have some questions or you want some specific details. Please give a call out to Prairie Ridge, and folks can help you out with that. We've received no significant guidance from CMS to date, and so we are loosening things up, loosening restrictions in accordance with the parameters that we've had now for some time. In terms of the hospital here at main campus, really no change from where we've been. We still have the 2 visitor policy, and really other than that, no significant changes to note. I'd like to talk a little bit about vaccinations now and how that process is going and what to expect in the future. This week, we will expect to give again about 500 vaccinations, approximately a little bit less, but approximately 200 of those will be prime doses, and approximately maybe a little bit more will be booster doses, about 300 booster doses. So we expect to do about 500 again this week. Our allocation from Moderna for prime doses is going to be 170, and we believe that is going to be the same through the end of March. And so we're not really expecting much change in that. We have been receiving all of our booster doses, and so that continues not to be an issue. And you can be comforted in the fact that that second dose will be here for you when you need it. In terms of the Johnson & Johnson vaccine, that is being made available on a kind of a limited basis, and really not coordinated all that much by the health systems, but really as a county allocation. That is in addition to the Moderna. Sioux County gets 500 Moderna vaccines doses a month. We get about 170 of that. In addition to that is the Johnson & Johnson. That is being pretty specifically identified for agricultural related industries, and those particularly with congregate work settings. And so that is being coordinated separately from the general population. In terms of wait list, we have about 244 currently on our wait list. And so we're encouraging people to call in and get on that wait list. Currently, in addition to healthcare workers and nursing home workers and first responders and teachers and those 65 and older, we also now are accepting 64 and under with comorbid conditions. Now, the key question, of course, is what's a comorbid condition? For the complete list, you can go to our website or go to the state Iowa Department of Public Health website, but maybe our website's a little easier. But things like diabetes, hypertension, asthma, if you're a smoker, and here's another one too that you might want to think about. If your BMI, your body mass index, is 25 or greater, that qualifies as a comorbid condition. And one of the ways you can check that BMI score is if you happen to have my chart and you've had a visit recently, or you can go back to your last visit, take a look. I believe on the after visit summary in the upper right-hand corner, there's a BMI that's projected and given. So that's something that you could look at. If it's 25 or higher, that's an automatic comorbid condition, and you can certainly qualify. But there are many more of those too. And basically, most people probably would qualify, but please check that out. And we really encourage you at this point to get on our list, because we do believe that we will be meeting our demand here in the next couple weeks, and that basically at this point, we need people on a call list in the event that we have some no-shows or people got a vaccine somewhere else. that we want people to be able to be called and to be able to give you a call and have you come in and get that vaccine. So please call, get on our list, or go to our website and fill out the form as well. In addition to that, Hy-Vee is still getting weekly Moderna allocations. The difference, and that's an online sign up, and so we encourage you to go there too and try that if you'd like to do that, but that is online. One thing that's different about the Hy-Vee allocation is that that's a federal program that's being federally allocated, and so Hy-Vee does not have to comply with some of the state regulations that we're complying with in terms of the 64 and under with comorbid, or the 65 and older, or the PK through 12. All of those criteria, it's our understanding, do not have to be followed from Hy-Vee because of the federal allocation. And so that's a good thing. It's much freer in terms of that, not as much red tape involved. So please take advantage of the Hy-Vee allocation. Take advantage in your work setting if we do get the Johnson & Johnson, which is a single dose, in your work setting. And please consider, if you're 64 and under with a comorbid condition, please consider getting on our list and signing up. We really encourage you to do that. We want as many people to be vaccinated as possible. So the numbers are good. We're not completely out of the tunnel of COVID yet, but we're, maybe the hood of the car is out at this point. And so we want to keep it that way. We don't want to let our guard down. And so we're asking you to continue to get vaccinated, continue to be vigilant when you can't be in circumstances where it's not safe or you're not socially distanced. Please consider wearing your mask. Please consider doing that. So stay strong, stay vigilant, and stay healthy. Thank you for joining us for this 96th edition.